coexisting conditions. ADHD doesn't cause other psychological or developmental problems. However, children with ADHD are more likely than others to also have conditions such as A. Oppositional defiant disorder, ODD, generally defined as a pattern of negative, defiant and hostile behavior toward authority figures. B. Conduct disorder, marked by antisocial behavior such as stealing, fighting, destroying property, and harming people or animals. C. Disruptive mood dysregulation disorder, characterized by irritability and problems tolerating frustration. D. Learning disabilities, including problems with reading, writing, understanding and communicating. E. Substance use disorders, including drugs, alcohol and smoking. F. Anxiety disorders, which may cause overwhelming worry and nervousness, and include obsessive-compulsive disorder, OCD. G. Mood disorders, including depression and bipolar disorder, which includes depression as well as manic behavior. H. Autism spectrum disorder, a condition related to brain development that impacts how a person perceives and socializes with others. I. Tic disorder or Tourette syndrome, disorders that involve repetitive movements or unwanted sounds, tics, that can't be easily controlled. Adult ADHD and childhood trauma, is there a link? There is evidence to suggest a potential link between childhood trauma and the development of ADHD symptoms in adulthood. While not all adults with ADHD have a history of childhood trauma, research has shown that individuals who have experienced trauma during childhood may be more likely to exhibit ADHD symptoms in adulthood. Here are some important points to consider. 1. Correlation. Several studies have found an association between childhood trauma and the presence of ADHD symptoms in adulthood. These symptoms may include difficulties with attention, impulse control, emotional regulation, and executive functions. However, it's important to note that correlation does not imply causation, and the exact nature of the relationship is complex and multifaceted. 2. Trauma and brain development. Childhood trauma, such as physical or emotional abuse, neglect, or adverse experiences, can have a profound impact on brain development and functioning. Trauma can affect areas of the brain involved in emotional regulation, impulse control, and attention, which are also implicated in ADHD. These shared neural pathways may contribute to the overlap of symptoms. 3. Shared risk factors. There may be shared risk factors that contribute to both the experience of childhood trauma and the development of ADHD. For example, genetic factors, environmental influences, and disrupted family environments can increase the risk of both childhood trauma and ADHD. 4. Differential diagnosis. It is important to consider the possibility of misdiagnosis or the presence of comorbid conditions. Some symptoms of ADHD, such as impulsivity and inattention, may overlap with symptoms of post-traumatic stress disorder, PTSD, or other trauma-related disorders. Accurate diagnosis requires careful evaluation and consideration of the individual's history, symptoms, and context. 5. Treatment considerations. If an individual with ADHD has a history of childhood trauma, it is crucial to address both the ADHD symptoms and the impact of the trauma. Therapy approaches that target trauma-related symptoms, such as trauma-focused therapy or cognitive behavioral therapy, may be beneficial. Additionally, treating ADHD symptoms through medication and/or behavioral interventions can also be part of the comprehensive treatment plan. It's important to note that not all individuals with ADHD have experienced childhood trauma. And not all individuals who have experienced trauma will develop ADHD symptoms. Each person's experience is unique, and multiple factors contribute to the development and manifestation of ADHD. Further research is needed to better understand the complex relationship between childhood trauma and ADHD in adulthood.